very full schedule this afternoon. I'd first just like to acknowledge that I'm joining you from the land of the Gadigal people from the Eora Nation, and I'd like to recognise elders past and present and acknowledge any Aboriginal people who've joined us today. And many of us are joining from different Aboriginal lands in different parts of Australia. So my name's Cathy Sherrington. I'm a professor in the School of Public Health at the University of Sydney and the Institute for Musculoskeletal Health, which is a partnership between the University of Sydney and the Sydney Local Health District. Within the Institute, I lead a program of research on physical activity for older people and people with disabilities. But I'm joining you with another hat as well. So I'm a parent of a para-athlete, and in that, that's led me to take on some voluntary roles. So I'm the secretary of the Cerebral Palsy Sport and Recreation Association of New South Wales, and also a board member of CPISRA, the Cerebral Palsy International Sport and Recreation Association, on behalf of Disability Sports Australia. And I've been the chair of the scientific committee for this upcoming conference. And many of the other scientific committee members and many people from those other organisations that I've mentioned are going to join us today. So this session is a free webinar that is the first part of a 4-day conference, which is hosted by CPISRA and run by CPISRA and hosted from Disability Sports Australia, the Cerebral Palsy Alliance in Sydney, the Cerebral Palsy Foundation in the US, with support also from CPISRA and also our Institute for Musculoskeletal Health. And so I'm going to chair the first part of today's session, and then I'm going to pass over to Maria McNamara, who's also from the University of Sydney, as well as from the Cerebral Palsy Alliance. And so my first job is to introduce Kelsey Singh, who's from Disability Sports Australia, who's going to add her welcome.
Hi everyone, my name's Kelsey. I am the General Manager of Sport at Disability Sports Australia. On behalf of DSA, just wanted to welcome everyone to, I guess, the unofficial launch of the CPISRA Conference in this first sort of general public session. We're really proud to be partnering to deliver this conference virtually. It's been a long time in the making, given some of the delays. And I really hope today everyone here is able to get a really good understanding and learn more about parasport and disability sport locally, and hopefully if you're international, you get some learnings to take back for any international participants. So I'll chat to you more at the end of the session, but yeah, welcome.
Fantastic. Thank you so much, Kelsey. So our first speaker in this session is Emma Beckman, who's from the University of Queensland, and she's also a Paralympic classifier as well as a researcher. And so Emma's going to give us a bit of a background about what classification in parasport is. So over to you, Emma, and yes, please start sharing your screen.
Okay. We worked well in practice, but it's always a risk on the actual session.
Perfect, Emma.
Thank you so much for having me here, everyone. It's a pleasure to be here because classification really is my passion. I am an accredited exercise physiologist and a sports scientist and an accredited classifier for both Australia and internationally for World Para-Athletics. So I'm going to give you a very, very brief overview of classification today. There's a lot that we could go into, but in the short time frame, I guess I just wanted to give you a little bit of a sense of why classification is important, what it's all about, and sort of send you in the direction to get a little bit more information if that's something that interests you a little bit later on. So, oh, there we go. The reason I put up this slide is just to highlight quickly that there's lots of different organisations that manage and run and organise parasport competitions. And the reason I always mention this is because the context that I'm coming from in terms of classification today is actually the Paralympic Games or World Para-Athletics. So that's my background and that's my history. And we know that there's lots and lots of different systems and organisations that do run parasport opportunities. So potentially the flavour that I'll give you today will give you a brief understanding, but depending on the impairments of interest or the organisation that's running the competition, there may be some slight differences. But obviously, given the context of the conference, I will be focusing a little bit more on disabilities and health conditions like cerebral palsy. So I always start when we talk about classification, trying to think about how sports are organised in lots of different ways. So when we think about sports like soccer, we think about them being different grades. So as you train really hard and you get better at soccer, you often go into a different grade, which could also be called a class. So that's what we call a performance-based classification system. There's also sports like golf. And again, as you get better, you get a handicap. So that is a system of classification as well. But in sports that are determined by strength and power, and we think about Olympics and Paralympic Games, we think about events like a 100-metre sprint. And really, the classification systems that exist in something like a 100-metre sprint is something for people without disabilities, like how we divide males and females, because we know that there are certain characteristics that influence the outcome of sports competitions. So essentially what classification systems aim to do is actually minimise the impact of these types of characteristics like sex and gender, males and females, on the outcome of competition. There's other sports like wrestling and rowing that use body size because we know that that has a huge influence on the outcome of competition. So when we think about parasport, how is it organised? What is the point of classification? Well, essentially, we know that someone's impairment and the severity of their impairment is going to impact on how they perform in sport. So the whole aim of classification is to minimise the impact of impairment on the outcome of competition. So we group athletes together based on how much their impairment impacts on their sport performance. And this is actually really important because have a think for a minute about how an impairment or a disability might impact on a 100-metre sprint versus something like javelin. It really is very sport specific. So we have to take this into consideration in classification. We know in Paralympic sport that there are 10 eligible impairment types. And this might seem a bit strange. This isn't a health condition. This isn't a disability. We're talking about eligible impairments. So when we think about cerebral palsy, the impairments that are generally eligible as a consequence of health conditions like cerebral palsy are hypertonia, ataxia, and athetosis. So when I talk about impairments, these are the impairments of interest that I mean specifically in these classes. And in order to be eligible for parasport, particularly in Paralympic sport, we have to meet minimum impairment criteria. And essentially that means that despite the fact that someone might have a condition like cerebral palsy, it doesn't necessarily mean that they're going to be eligible for Paralympic sport. So as health practitioners, as coaches, and as members of the general public, we do have to be really careful when we start talking to athletes about the possibility of going to the Paralympic Games, because classification is a huge part of both sport entry and where you end up fitting into competition. So I'll just give you a really brief overview of the classification process to give you a sense of what might actually occur in the room during classification. So in athletics, that's the context that I come from, we have two classifiers. One is medical, generally a doctor or a physiotherapist, and the other is a technical classifier. And this is someone with a lot of sports background. So as someone who is an exercise physiologist and a sports scientist, I have a background in biomechanics. And this is the training or the tertiary education that I needed to enter as a technical classifier. But we also have some incredible athletes. So athletes that have previously competed at a really high level that are also technical classifiers in our sport. And they bring us an incredible perspective on how impairment impacts on performance, and genuinely a really important part of the classification process. So we need medical documentation to confirm diagnosis. Classifiers are not allowed to do that. So that is an absolutely imperative step of the process that should be managed. Then classifiers start to ask questions. They ask questions about training history and medical history and factors that might influence what they might see with the athlete in front of them. We use some clinical tests to confirm the presence of impairment. And then we use some more sport-specific tests to sort of start to understand how impairment impacts on movement and sports performance. We may also see them in competition. And this is a really important step to make sure that what we're seeing on the bench tests or in the classification room is consistent with what the athlete can do on the track. So we get them to go out and maybe do a 100-meter sprint or do a shot put or a javelin or a discus activity or a long jump to make sure that what we're seeing is consistent. I'm just sharing briefly the types of class profiles that we have for athletics. And what you'll see from these descriptors is that it's actually quite a tough job sometimes for classifiers to make an athlete fit into a particular class profile. And I know a lot of athletes out there know that they don't fit perfectly into the wording that we use and they feel like they're disadvantaged. But it is the job of the classifier to use the information that we have to match the athlete as best that we possibly can with the class profiles that are available. Classification has been slowly developing in terms of evidence, and it means that tests are being implemented in classification that feel a little bit more scientific and rigorous for the athletes and the observers in classification. So now we measure things like split jump tests and running on the spot and bounding tests to make sure that we understand the difference between, let's say, for example, so what an athlete can do with their left leg compared to what they can do with their right leg. And this helps make sure that classifiers all over the world, when they perform classification, are making the same decisions. It improves our reliability. Whoops. So the last couple of minutes, I just wanted to touch briefly on classification in terms of the differences. So there are different systems for all sports. So the system that you might see in place for swimming is very, very different to the system that you might see for athletics. We know that there are certain challenges with classification, and we know that one of them is that it's evolved gradually. We've had a huge influx of athletes to parasport over the last couple of decades, and this has made it difficult potentially for classifiers to place athletes into the correct class. There's a lot that we don't know about how impairment impacts on performance, and there's a lot of really important research going on, including some from our lab, that helps us understand what the impact of impairment is on performance and will help us in the future make sure that we put athletes in the correct class. There are classification codes that sports must adhere to make sure that policies and procedures are correct and that all athletes have the best opportunity to be placed in the correct class. I think the final thing that I really wanted to touch on is sort of maybe the elephant in the room, potentially for some people when they think about classification, because there is a lot of contention around some classification decision. And I think parts of why that's the case is because people only see the final product. So many of you will watch a Paralympic race, let's say 100 meters or 200 meters, and all you'll see is the order in which the athletes finish. And sometimes it can really appear that there's a large discrepancy between the ability or the impairment that is in that particular race. The thing that I would caution people to understand is that we never truly know what goes into making those decisions. Athletes' training can influence on their performance much more potentially than their impairment in some situations. So it's really important that we don't simply say just because someone wins a race that they're probably less impaired than the rest of the competitors in their class. This is a really false assumption that we're trying to get away from in Paralympic sport. There is a strong basis and scientific rationale around classification, and while there is a huge variability in the impairments that present and the range that can present in a particular class, we need to make sure that what we're thinking about classification and the way we talk about it is correct and fair to the athletes. So there are ways that we're looking at making classification better. Oops, I don't know where that last slide went. There are ways that we are looking to make classification better as a movement, as a Paralympic movement. And this includes standardizing some of the tests that we do. So we're creating, instead of some of the clinical tests, there's a lot of work that's going into developing really valid measures of impairment, looking at biomechanics and better understanding the relationship between impairment and performance. And we have incredible athletes that have volunteered for this research, and they are a really important part of the process, and we can't thank them enough. So that's a really brief overview of classification, and I'd really be happy to take questions in the chat and things as we go along. But I really want to thank all of the athletes, coaches, staff, classifiers who do an incredible job with classification, which really is a tricky space. Thank you.
Fantastic. Thank you so much, Emma. I should have mentioned that Emma was also a member of the CPISRA Conference Scientific Committee as well. And it's been a joy to work with her as we've put this together. So yes, thank you, Emma. That was really helpful. So next we're going to hear from Lizzie Slack about the experience of competing internationally. So over to you, Lizzie.
Thank you. And I just want to apologise if it's a little bit noisy around. I'm in the office. So I guess I'll just start with kind of who I am. So I am a para swimmer. I don't have CP, but I have another genetic disability. I still swim for fitness at the moment, but I officially retired about a year ago. I was on the Australian Development Program for about 4 years, and during that time I went on various camps, competitions, and trained at the Australian Institute of Sport kind of on and off, and I was training about 9 times a week in the pool and 2 to 3 times in the gym. I went to 3 World Series, 1 in Melbourne, 1 in Singapore, and 1 in Sheffield in England. I guess from Emma's talk, was kind of one of those ones that didn't fit neatly into the classification system. So my kind of classification journey was a bit rough, but I kind of from all those experiences found my way to coaching as kind of my way of continuing in the sport. But those experiences that I had competing internationally, I'm so grateful for. They gave me a lot in terms of friendships. Some of my best friendships are now my swimming friendships, and they're from kind of everywhere. We rarely are able to get together, but even in Australia, we still come together. Probably only half of us are still swimming, but it's those lifelong friendships that I was able to make. And then it also gave me my health. I guess I can probably guarantee that I wouldn't be in the kind of physical position that I am in now if I hadn't been swimming. And that's something that I'm really, really grateful for. And then the other thing would be coaching. So I now coach people with disabilities and people without disabilities, but there's a group of kids with, well, young adults with CP and various disabilities that I coach through the Cerebral Palsy Alliance. I thought I would kind of do some advice to athletes and parents if there are kind of any of you out there, but my advice in terms of getting started and working your way through that kind of progression would be, I think a lot of people from my experience can find it really hard to find a program that works for them. But I would say call around, see what people can offer. And it's also not necessarily about the experience that that coach has, but also about their kind of motivation and interest to develop their skills, their motivation to learn about the disability, the ability, the exemptions of the classification system. When I first started with my coach 11 years ago, we were both very new and fresh to para swimming, but we've learnt along the way, and we're now very good friends, and he's my boss. My other advice would be, again, kind of relating to what Emma said, but just try not to get caught up in other people's classifications and other people's times. That's something that I am still learning myself to do this, but it's something that you can't control. You can only control, what you do, how hard you train, how much you train. And every time you're in the pool, you're racing against your own times, and you want to beat your own times and get the best out of yourself, because you really can't control what anyone else does. And then my advice for coaches who are kind of new to the world of parasport, I have found that I've been really grateful to coaches that have done this to me, and I try and do it with my athletes, but just trying to treat anyone with a disability as you would an able-bodied person. Don't treat them differently or with a different set of expectations of what they can do just because they present with a disability. Their physical limitations are something that you need to work together to figure out what they can do, rather than saying, oh no, they can't do this. They can do it, they just need their own supports or different ways of being able to do it, but essentially you can get to that same end point. And then the other thing would just be flexible. People with disabilities often have a lot going on in life in general, and so you kind of need to get a bit inventive of how the person is training and what they're doing outside of the immediate sport in terms of strength or whatever. So when I first started, I couldn't go to the gym, so I was doing acrobics. You know, there was about a 50-year age group between us, but that was my kind of strength. And then I have other people who, you know, their warm-up is their physio exercises, or instead of going to the gym, they're doing Pilates. So it's just being flexible in how you approach that kind of holistic management of the athlete and the person with a disability. So yeah, that's kind of all I had to say. I'm also happy to be contacted throughout if anyone has any questions, but yeah, thank you for having me.
Words for anyone, I think, Lizzie. Thank you so much.
Thank you.
And so, yes, and people feel free to use the Q&A to ask any questions as well. So next we'll hand over to Murray Bartram, who's also going to tell us from the perspective of a person living with a disability, the experience of participating in parasport and any sport. And Murray is an executive committee member with CPISRA New South Wales. So over to you, Murray.
Thank you. So I've been told to talk about the benefits of sport for people living with a disability. So I played sport basically my entire life, and I'm now 32, and it's always been the backbone of my life. It's something I've always done. For me, the physical and mental health benefits are huge, especially the mental health benefits. Having a disability, there's a lot of aspects we're going through as a teenager. There's other things you've got to tackle. So having sport to kind of lean on and learn skills and build your community, and kind of feel included in things has been a huge thing. And the big benefit is creating independence in a low-risk environment. So what I mean by that is, if you have a disability and you go play sport, you have to do things to basically to force yourself to be independent. But it's not like reading a book or doing a course or anything like that. Sport kind of forces you to be independent over time. There's also a lot of life skills you learn in different aspects of sport, which I'll talk about in a second, which to me have transferred all the way through to work. And sport definitely increases your quality of life. So I have cerebral palsy, left hemiplegia. Like I said before, I played cricket, soccer, bike riding and bodyboarding kind of when I was younger, through my teenage years. I did get involved in kind of the Paralympic pathway of track cycling, football, and ski racing, which was greatly beneficial at the time. But unfortunately, I was classified out of ski racing, which is kind of where I ended up, which kind of put me on a whole different pathway, which is when I kind of discovered the love of adventure sports. So once the Paralympic pathway kind of closed to me, I ended up doing a lot more backcountry skiing, mountain biking, and kite skiing. This took me over to Alaska, and I ended up skiing out of helicopters in Alaska. I lived and worked in Jindabyne for 2 to 3 years. Which, all the skills you learn in adventure sports and the people you meet and the community you build is pretty much the backbone of my life. So more recently, I've started to play, being based in Sydney, I've started to play a bit more tennis, golf, and started taking up surfing, which is really, really hard. I currently work at a company called MLC as a technical technical business analyst, which a lot of the skills that I learned from doing adventure sports pretty much I use in risk analysis, communication preparation, is kind of pretty much is the background of what I do at work. I didn't go to university, I didn't study doing any of that stuff, but I ended up working with people who have, you know, double or triple degrees, but we do the exact same job. I purely believe that it's from the sporting background and everything I've learned in sport gave me that kind of framework to bring into the industry and really excel quite quickly. Personal goal setting in sport really is another huge thing, which is a benefit from being involved in sport as someone with a disability. The other big one is probably very true for me is if you're involved, you know, body sport as someone with a disability, without realizing, you can kind of teach a lot of people around you about disability. You know, like they can learn from you and you can learn from them, which has been a big thing. And the other big point for me with sport is that it doesn't matter what level or what sport you're involved in or how able or how disabled you are, the benefits are pretty equal for everybody. And it's been hugely evident for me in tennis, watching somebody who's in his 40s come into tennis and his life has completely changed being included in community sport. Yeah, pretty much done, Kathy.
Exactly what we were after. I'm going to hand over to Maria, who's going to chair the second part of this session.
Thank you, Murray. That was very inspiring. It's absolutely amazing. And I love the photographs that you had to go in the presentation as well. So next up, we have a panel discussion, and we have Mark Liberatori from Cerebral Palsy Alliance. He's an allied health professional, exercise physiologist, or exercise scientist, as it's also known, and as well as Lauren Dadd, also from Cerebral Palsy Alliance. So, we also, I think as part of the session, we also have Associate Professor Lauren or Leanne Hassett joining us as well, and then later Kerry West. Thank you.
Thank you so much, Maria, and really excited today to be introducing the impacts and influence an exercise physiologist can have for people getting started with parasport and recreation, particularly here in Australia, and just for our international audience, recognising that exercise physiology is quite well known in Australia. In some countries, it's better known as physical therapy. So just depending on your location, we're hopefully talking the same language here. So the next slide introduces a little bit about what an exercise physiologist is. And basically, an accredited exercise physiologist is an allied health professional who utilises exercise as a therapeutic modality. So you'll often hear exercise physiologists talk about exercise being medicine. And more broad to that is really promoting the benefits of physical activity. So we use exercise to treat and manage acute, subacute or chronic medical conditions, support people post-injury, and also support people living with disability. So to be an exercise physiologist, you do need to go through a bachelor's degree of generally 4 years, and everything we do is evidence-based in intervention. So a big part of what we do is to try to support people living with disability, managing people who have chronic health conditions and injuries, as I mentioned, and also address lifestyle and behaviour modification, which is a really big focus for AEPs. We also prescribe holistic exercise programs tailored to improve the individual's overall condition and, of course, quality of life. And just tying into what Murray mentioned, the next slide talks a little bit about the benefits of being physically active and also participating in things like sport, which is why we're all here today. And As Murray alluded to, it's much more than just the physical. There are a range of different benefits associated, and exercise physiologists really do try to take a holistic approach when supporting people in that journey. So the next slide dives into a bit more detail around how an exercise physiologist can help people get involved, particularly people living with CP or post-acquired brain injury. And a big part to begin with is getting your body ready and preparing you for that participation in sport. So an example might be increasing your strength to prevent injuries or any muscular imbalances, or increasing some of the sport-related components of fitness, so increasing agility, balance, coordination, all the different things you need to participate confidently in sport. Also looking at gross motor skill development and understanding how to participate safely in an environment before going out and participating in that community setting. So another thing they do is support the support crew. So providing education to families, carers, community sports coaches, and really getting that local, I guess, club or participation aspect ready for participation. So a big way that we do that is to break down barriers to participation and increase inclusion by introducing things like simple modifications to improve those participation outcomes, and also communicate really closely with all of the different support networks involved in that journey. So that's a really quick introduction, and I'm now going to hand over to Lauren, who will speak a little bit more about how an exercise physiologist can help that journey.
Thank you. So as an exercise physiologist, I'm driven by the need for inclusion and increased opportunities within society, so everyone can find a sport or activity that they find enjoyable, that enables them to engage and be invested and valued as a member of the community. So that might be something like swimming down at the local pool, or something as wild as kite surfing in Alaska. I often see my role as a therapist as someone who can disseminate knowledge and break down those barriers to participation. What this looks like and how it's delivered changes greatly depending on the individual's needs. Whether it's generally preparing the individual for sport through skill development, like learning to run to join soccer, or developing physical strength for muscular imbalances to prevent injuries. Sometimes my work as an EP is outside of the gym, taking on an education-based role, working with coaches, swim schools, and parents around supporting an individual to thrive within a recreation environment through communication strategies, equipment modifications, or visual programming, such as social stories, to enable greater understanding. There is a high incidence of associated impairments within cerebral palsy, and these are often the physical barriers that need to be considered to provide inclusive environments. Sometimes this involves developing effective two-way communication strategies during training and play, monitoring and managing pain and medication interactions with exercise, and ensuring understanding and clear instructions are being conveyed for all individuals with intellectual or hearing impairments, for example. The increase in fatigue and secondary health conditions, including anxiety and depression for people with cerebral palsy and acquired brain injuries, are all added complexities that can become an everyday barrier to participation. These are discussions that can be guided by a therapist and managed early to provide the smoothest pathway possible to commence development of an active and healthy lifestyle that suits you and your family's unique needs and leaves you feeling empowered and confident to participate. The ideal sport or leisure activities looks different to everyone. For me, the key isn't about high-level elite competition, but rather about helping you find your people and having shared experiences that present the right level of challenge to keep you engaged and motivated. Research suggests that engaging physical activity as a child predicts participation in exercise as an adult, which will long-term reduce your risk of chronic disease, injury, and illness, while simultaneously developing competence and confidence. Training needs to be suited to your current interests and lifestyles. For some of my clients, this has meant getting outside of the therapy centre and training at the local beach, or at the university gym between classes, or sometimes pulling together a range of skills that they've been working on, such as frame running and swimming, and training as a team to enter community events such as a triathlon or a Tough Mudder, Blackmore's Bridge Walk, or even the Mardi Gras Parade. The drive to be engaged and involved within society has a huge appeal to all of us, and fostering this desire can maximise participation outcomes. I'll finish up with this lovely quote from one of my swimmers, which really epitomises the positive aspects of sport, even within an individual activity such as swimming. I've been swimming with the other people in this group since I was 6. It's good to see them at competitions because then I'm not so nervous. I'm just there to have fun and swim with my mates. As an exercise physiologist, I was able to help this family commence participation in a number of ways. Through direct skill development, firstly by teaching the participant to swim, providing a safe space to try competition, and educating and providing support for the family through the classification pathway and selection of events to get them into their first competition, until they had the knowledge and skill set to continue attending independently alongside their new teammates. As I've mentioned, the support a therapist can provide looks different to everyone, so don't hesitate to reach out if you want more information.
Thank you very much, Lauren and Mark. That was a really nice overview from the perspective of exercise physiologists. Thank you. So next up, we have Associate Professor Leanne Hassett from the University of Sydney. And Leanne, with myself, we're on the scientific committee for CPISRA Conference together. So welcome, Leanne, and yeah, thank you.
Thanks, Maria. So I just want to share some experiences, I guess, I've had as a physiotherapist working with people after traumatic brain injury. So I worked for 15 years in the brain injury unit here at Liverpool Hospital in Sydney. And I guess thinking about sport in rehab is a really key part that physiotherapists do. So right from the beginning, when someone would have an injury and we're starting that initial assessment, we're wanting to know the types of pre-injury types of activities and sports that we're involved in. And very much thinking about that return to sport being a really key part of their rehab and really framing their rehab about returning to sport if that's something that they do have interest in. So the types of activities that I would do as a physiotherapist in that role is looking out for the appropriate opportunities for people. So, web searches, talking to colleagues, speaking with national and state organisations to identify, the types of opportunities of different sports for people. At Royal Rehab, they used to have a wonderful sport expo, and that was a really good opportunity to really connect health and community sporting opportunities. And from that, at our unit, we ran a number of sporting opportunities within the rehab process. So bocce, touch rugby league, soccer and table tennis, just to name a few. And, from those, opportunities within the rehab setting, a number of our clients would then go off and join community opportunities for those. Within rehab, we also would do skills training in preparation for people going back into sport. So, as physiotherapists, we have that expertise in the types of impairments people have after these types of injuries. And so we're able to really, work on improving their impairments and doing that real task-specific practice to help them be prepared to have success when they would go back to the type of sport that they wanted to participate in. One of the big areas that I think as physios that it was really important that we actually went out with the person to those sporting opportunities, particularly initially. So I found that people would have more success getting back into the opportunities if they had that extra support of someone with them. So I can think particularly of two young men that I took out to Pararoo, so the soccer development camps out at Narrabeen for a weekend camp, and just being able to provide that extra information to the coaches about the types of impairments that the two boys had really helped to make that a more successful opportunity for them, and then linking in with weekly opportunities for them to participate. And I just will draw your attention to finish off with tomorrow. I think tomorrow at the conference, there's going to be a wonderful presentation from Kavya Pillai, who is a physiotherapist at Liverpool at the moment, and she's going to share her experience of helping an elite BMX athlete return to getting back on his bike. So that'll be a really good presentation to see. So thank you, Maria.
Thanks so much, Leanne. That was great. It was really nice to hear about the, providing support in the community setting and therapists actually going out there to events and supporting the people they're working with. So it's really, really nice. So next up, we have Kerry West, who's head physiotherapist at the Children's Hospital of Westmead. And she's also a PhD candidate at the University of Sydney, as well as being a swimming classifier. So Kerry is a very busy person indeed. So thank you very much, Kerry.
Thanks so much. Yes, I've got all those different hats, and I'm also, similarly to Kathy, the parent of a para-athlete as well. So my daughter has mild cerebral palsy and is a very keen sports person, and I've sort of been on the journey with her as well, of finding sporting opportunities and whether they be competitive or sort of just for enjoyment and participation. And I think that's something, listening to everyone speaking so far, and whether it be exercise physiology or physiotherapy, I mean, we really pretty much in this space are doing very similar roles, I think, of trying to sort of help children, young people, adults with disabilities find the right sporting opportunity for them. And Murray as well, in his presentation, I think, he was very involved probably earlier on trying to find that competitive pathway through to maybe being at the Paralympics, which is a lot of people's goal. But I think also there's many, many, many people, probably more commonly, that just want to have fun with sport like everybody else. And really the majority of the mainstream, that's what sport's all about too. So I think in disability sometimes there's a bit too much focus on the Paralympics and every person with disability thinking they might have that as a potential. But I think more so, particularly like through my work as a paediatric physiotherapist, it's really initially trying to connect people with sport for the fun aspect of sport, and for the health benefits of sport. So, and I've been very involved with many children with physical disabilities over my career, just trying to have that initial conversation. And often that's with the family, and maybe that's to try and fit in with the family so that the child with a disability can be involved in similar sporting activities that would suit the family, or, as they're getting older, something that they're motivated to do themselves and be involved in. And just as an example, I can think of one particular young man who actually ended up making it to the Paralympics, who I was involved with, who as a younger child was very into his sport, and mainly doing that in the mainstream, so playing soccer, joining in with all the school sports. However, because of his disability, he was not able to get to any high level of competition with any of those sports. And so then it was having a look at with him, what sports actually would suit him, or what would he be eligible for in terms of the Paralympics. And ended up being swimming as a sport that he wanted to pursue to that higher level, and he has actually made it to the Paralympic level. But I think, as a younger child, it was much more about joining in what was happening at school, playing soccer, and then looking towards what he could do at a more competitive level. So yeah, I mean, I think really my message is it's all about mostly having fun and participating. And then for some people, there are opportunities to do some of these things at the higher level.
Fantastic. Thank you very much, Kerry. That was really great. Yeah, lovely to finish up with that emphasis on having fun and enjoyment. So yes, I'd like to thank all the panelists and also acknowledge Mark's role in the organising committee as well. So we have quite a few committee members here tonight presenting. So thank you very much, everyone. So we have another series of speakers now. So we have Rita Morgan and Kelsey Singh, who you met earlier from Disability Sports Australia, and Caitlin Keefe. So Marita she's the operations manager at City Community Tennis, and she's also on the CPISRA committee as well. And Caitlin is a coach and disability support practitioner at Cerebral Palsy Alliance. So thank you very much, everyone. I'm looking forward to seeing your presentations.
So I'll go first, Maria. It's Marita. Yep. Okay. So I'm just going to briefly mention to you a little bit about what the Cerebral Palsy Sporting and Recreation Association is. So Cerebral Palsy Sporting and Recreation Association, CPISRA, is a New South Wales-based state sporting organisation. It's an organisation that aims to encourage sporting and recreational opportunities for people of all ages with cerebral palsy and other neurological conditions. Cerebral Palsy Sport and Recreation Association runs multi-sport connect days, social and community events, as well as celebrates achievements of its athletes at community, state, national and Paralympic level. Some of the sports our members are involved in include soccer, athletics, swimming, tennis, winter sports such as para-alpine skiing, wheelchair basketball and cycling. CPISRA can also help members or those that want to get involved in the organisation get involved in school sport and get involved in para sports in particular, such as swimming, athletics and cross countries, as schools in the public, private and independent and Catholic system offer regional, state and national level competition for athletes with a disability. CPISRA also offers financial support to teams and athletes who are involved in competitive sport. CPISRA can also connect its members to local sporting clubs and can also help with educating local sporting clubs to include athletes with a disability at a community and competitive level. CPISRA run multi-sport connect days at least 4 times per year and run social events regularly in person and online. These events include sporting organisations such as Disability Sport Australia, Netball New South Wales, Tennis New South Wales to come along and promote their sport, as well as athletics and CP football. But it also strongly encourages social participation and allows for members to try something new. It is also a chance for members to meet other people, especially like-minded people and people who are interested in getting involved in sport. A recent example of a social day that we've had is a tennis social day that was run with Jensen's Tennis, City Community Tennis, where we had a mixture of players with cerebral palsy and neurological conditions get together, play tennis, socialise, enjoy some food, and most of all, have fun, participate and feel included. So if you'd like to find out more about CPISRA and what it does, I can put in the chat a link to our website. Thank you.
Thanks so much, Marita. That was fantastic. So next we have Caitlin, and Caitlin is from Cerebral Palsy Alliance, as I mentioned earlier. So thank you very much, Caitlin.
Thanks, Maria. Hi, everyone. So yeah, as Maria said, I'm from the Cerebral Palsy Alliance. In particular, I work within the sports department. So I'm just going to give you a quick rundown on what we do and yeah, how to get involved in sport in Sydney in particular. So I guess I could talk for ages about this. So I'll kind of do like a little condensed version. Basically what we do, if you think about sport as a framework, we are the grassroots of sport. So we are here to offer opportunities to young people and old people of all ages access to sport. We have individual one-on-one programs, group programs and camps. In particularly our group programs, we have multiple. So we've got this girls squad program and a boys squad program where they meet every week and they play different sports every term. And the goal of those is to equip these young people with the skills of playing sport that they can then go and take away with them into their own schools and into their own community sport. And the goal for us, our end goal is to, I guess, let the athletes and let the kids move on from us. So I guess once they no longer need us anymore, we've done our job and we've put them on the right track to then go higher through the ranks of elite sport, if that's what the goal is. So in terms of the camps that we offer, we run a number of camps every year. So we run multi-sport camps, football camps, swimming triathlon camps, snow camps. So we take a group of young people to the snow and go skiing, which is amazing. I'm yet to go on one of them, but yeah, I'm very excited for when I do. We also have a triathlon club, which we've just newly started, and we also have a swimming club, which meets every week. So it acts as a few of our athletes, I guess, local club. And so they train with us every week and go off and compete at state, national, and hopefully even international level competitions later on in life. So yeah, I guess in terms of what our goals are, kind of like Kerry was saying, to have fun. So fun is one. We've got 5 main goals in everything we do. Fun is one of them. Friendships is another one. Fitness, games, and skills. And they're really what we focus on. We use like a physical literacy framework with every single one of our athletes to ensure that they're getting, you know, the necessary, I guess, skills that they need in order to live a higher quality life, as Murray was saying, which sport provides people. And as Liz was saying, you know, we're providing these people with friendships for life. And I think that's one of the main things that we see out of our organisation, especially in our department. I guess if I can, I'd like to leave you guys with like a little story. So it kind of outlines a little bit about what we stand for and who we are. So we have a race running, I think it's now called Frame Running Group. And one of our young girls has now, her family's moving interstate. So she's in year 5, I think. And we're going around in the circle last week, and her other year 5 friend said a little piece about her. I'm pretty sure it brought us all to tears. She said something along the lines of, I love you and I miss you and you're a beautiful person, but don't worry because I'm still going to FaceTime you. And they're the kind of relationships that are formed in the groups that we have. And yeah, it's super special and yeah, love it. So thank you so much. And happy to answer any questions as well, like everyone said.
Thanks so much, Caitlin. Really lovely examples there and a really nice story to finish up on. Thank you. So our final presenter is Kelsey Singh, whom you met earlier, and from Disability Sports Australia. So thank you.
Yeah, and I think one of the big takeaways from just listening to the last hour, I think, and I hope this gets across over the 4 days of the conference, is participation in sport and active recreation takes a village. It takes every part of someone's life, whether it be therapy, allied health, sport and education. I think for us, it's really about the holistic journey for someone who wants to participate in sport. DSA's mission is to make more Australians more active more often, more Australians with a disability more active more often. And for us, we really see ourselves as not necessarily a program delivery opportunity, but the point of contact to connect you with programs in your area nationally. So how can we connect if any Australian with a disability who wants to participate, whether it be in a sport, a multi-sport come and try day, or just wants to have a go at something. And as I think was mentioned before, this is grassroots through to elite. Where do you start? And so we've just launched our National Referral Hub, which is all about connecting people to activities, connecting people to therapy, connecting people to allied health, to support services. And I think the big part of this is that you want people to be able to have, I think it's a confusing space sometimes, especially in Australia. Organisations like CPA and CPISRA are trying to really provide a really streamlined process into sport and active recreation. So we would love to connect people in Sydney with them. So that's sort of our piece of the puzzle, I guess. And there's so many ways there's so many local opportunities nationally, whether that be through school come and tries, whether that be through sporting organisation come and tries, working with national sporting organisations, state sporting organisations, state and national sporting organisations, people with a disability. There are so many opportunities out there. And I think the big part is just connecting people to those opportunities. So feel free to get in touch. I'm pretty sure it's on this side. Is our email, is our website. So get in touch if you want, if you're nationally. I know there is a lot of international people, there's a couple of international people on this call. I would suggest to you, get in touch with your CPISRA member about if in your country to sort of see what is your connection points and how you can get involved in sport, because they will know as well and want this to be beneficial for you as well.
Thanks so much, Kelsey. That's fantastic. So we've got a question in the chat for Caitlin. So it's, hi, Caitlin, wonderful program. What do you think about how your work could be made accessible across Australia, especially in regional or rural areas? So
yeah, that's a really great question. I was actually just typing to respond to it, but I'll just say it here. So unfortunately, due to COVID, so we actually had a plan to start to deliver a lot of our camps around rural areas of just New South Wales at this stage. However, it was postponed due to COVID. So that's something that's definitely in the works, and it's definitely something that we want to be able to do. And we talk about almost weekly because we know that, you know, there's such a large amount of families and of participants who don't live in the metropolitan areas, and they don't get as easy access to such simple things such as sport. So hopefully next year we will be doing those rural camps. We had one camp in June, which was in for our swimming triathlon camp, which was sponsored by Swimming Australia, and we had 15 rural families who were granted free 3-day weekend camp at Narrabeen, and that was a huge success. You know, we met families from all around New South Wales and the ACT, and we're still in contact with those families now, offering, you know, over COVID, offering telehealth practices like sessions and stuff like that. So it's definitely something that we're hoping to kick back off hopefully next year when COVID's no longer a thing, I hope, fingers crossed. So that's kind of where we're at now. Yeah, I hope that kind of answered your question. I'll pop my email in the chat as well if you ever want to reach out and talk more about that and those opportunities.
Thank you very much, Caitlin, for answering that question. And thank you very much to all of the speakers. And so, Kelsey, I just wanted to mention that DSA is national. And yeah, so we just so everyone is aware of that. So it's Australia-wide. And so I'll just remind people as well that there's a different Zoom link for the next session. So there'll be a short break, and that will start, I think it's 5:15. Is that right, Kathy?
Yes, that's right.
Fantastic. Well, thank you very much, everyone.
Fantastic. I'll just add my thanks. I see there's a question from Georgia Riley. Perhaps, Georgia, if you email DSA, so look for Disability Sports Australia, I'm sure yeah, Kelsey can help you find a Canberra contact. So yeah, just echo the thanks. What a fantastic group of speakers from really a multi-sectoral perspective. So we've got, you know, education, sport, health, and people with disabilities themselves. So yeah, absolutely fantastic. So yes, as Maria said, there's for those who are joining the next workshops, the pre-conference workshops, it will be a different link, and they'll be starting after a 15-minute break. For those of you who have just joined this free session, thank you very much. It's been a pleasure to have you, and we will record the session. The session will be recorded and will be made available. So yes, thank you very much again, everybody.